Next up is Ian Wright from Newmarket Equine Referrals. He has published numerous papers, as we know, on fracture management and written one of the newest fracture repair books. And he will be talking to us about triage and acute fracture management. So, perfect person for that. Thank you.
Connecting. Any good? There we go. Thank you very much. I did my best to get up on the stage before Samar for now clearly obvious reasons. I'm going to talk about triage, acute fracture management, good for horses and good for racing. And I use the first part of this talk to essentially paint a picture there. And we all know fractures in racehorses, significant cause of injury, morbidity and mortality, substantial economic loss. And historically, they've been considered what might be called an occupational hazard. But they are now a serious impediment to the maintenance of racing's social license. And as recently pointed out, embracing the values of the public, and that's the important thing, the public, not the people sitting here today, will be a key element in retaining the acceptance of not only racing, probably all sports. Now, there's been an explosion of knowledge in the subject area. I, only slightly junior to Samar, qualified 1979. So in 1982, when the book on the left came out there, which was the first dedicated book on equine fractures, 106 pages, large print, 7 chapters, total of 62 references. The book on the right came out last year, 838 pages, type print, 37 chapters. And the important bit is 2,652 different references, which gives you an idea of the amount of knowledge that's come to pass in that period of time. Now, the other speakers, and it's a fantastic program of speakers, are talking about prevention of fractures on the racecourse, which is ideal. Let's not get away from that. It's absolutely ideal. We don't know if it'll be practical. It may reduce the incidence, but as Tim pointed out, there is no silver bullet there. It will never be complete and absolute. There will be fractures on the racecourse. So my point is that mitigation of those fractures is critical to racing's future. This is a slide that I've used for 25 years talking to the ARVS course on casualty management. And it's really to emphasize that the veterinary surgeon's responsibility is patient care. Everything else is tertiary to that. And at the bottom of that list was public scrutiny there. But the truth is now, actually, after patient care, public scrutiny is probably our next biggest consideration. And that brings us to why is that important? Well, it's this thing of social license, easily bandied around. What is it? The best definition is the use of horses for entertainment and financial gain. It's intangible, it's implicit, and it's fluid. Public opinion changes constantly. The principal concerns are those based on horse welfare and safety. Namely, is it reasonable to expose horses to risk for entertainment and financial gain? Now, there's a massive geographic variation in the strength of public opinion and concern, but worldwide, that's rising. Now, we all know injured horses attract publicity, printed press, social media, TV, everywhere. And I'm not going to keep droning on about this, but we now have to face the fact that there are organizations with the explicit aim of bringing an end to horse racing as a sport. And this is a recent article from Financial Times, not noted for being a populist newspaper. And this is a North American correspondent who questions whether thoroughbred racing will survive her generation. She's 60 there. And the Peter Vice President's retort is that horse racing has never been closer to having its social license revoked. So it has to do something. So why do we need to address the public concerns? Well, simply, they attract political attention. There's a demographic change there. The further society moves on, the further people get away from understanding of countryside, agriculture, food production, anything else. The whole populace is drifting that way. It's raising ethical questions there, some of which appear in the veterinary press, namely, is horse racing too dangerous to be acceptable? And there's a smoking bomb there. And the smoking bomb is the Animal Sentience Bill, officially titled the UK Animal Welfare Sentience Act 2022, which means, amongst other horses, horses are considered sentient beings. They have feelings, emotions. And with that comes rights. And the truth is, no one's picked that up yet, but very soon, a welfare organisation is going to do it. And then we have a legal stick with which we will be beaten. Now, in my opinion, failure to be proactive is perilous. I don't think racing can do nothing. I really don't. And transparency is critical, and Tim made that point earlier. So we know we are going to expose horses to risk of injury. So what are the risks? And this is something I've just pulled out of some work that Chris and I are working on. And these are the published fracture and fatality rates there, so in journals, for the UK flat races. There's more recent data, but not yet published there. Basically, 1 in 1,100 to 1 in 2,600 starters there. Depends on the metric there, what you're measuring, fatality, fracture, whatever else there. How are we doing worldwide comparison compared with the US? 1 in 400 to 1 in 1,100. Australia, we're a little bit behind, 1 in 1,600 to 1 in 4,200. We get to jump racing, we're in sticky ground now. 1 in 200 to 1 in 1,100 hurdle starts. 1 in 143 to 1 in 730 steeplechase starts. The National Hunt flat race is 1 in 200 to 1 in 460 starters. Now the data's presented in a different way from Tim's, which his is epidemiologically preferred, but this is an at a glance, what are we doing, what are the risks? So how does optimizing acute immobilization, my subject area, mitigate the impact of racetrack fractures? In simple terms, we save more horses, and that's in two aspects. One is we save more horses on the racetrack. Whatever happens to them after they leave the racetrack is not racing's issue there. So we reduce fatality rates. From a humanity point of view, we reduce pain and anxiety associated with injury. And outcome is improved. All studies show if you're dealing with fractures, acute fracture management, appropriate management optimizes outcomes. So we restore economic value, return more horses to function, and very importantly, we improve horses' quality of life post-injury. In simple terms, the horses win and racing wins. We have to think a little bit about how fractures occur because there's a logic to this. At least in simple terms, bone's just like any other material, piece of stainless steel, wood, plastic, whatever. Bones fracture when the forces that they're exposed to exceed their ultimate strength there. And that strength in different ways, bending, torsion, all manner of things. There are broadly two sorts of fracture. A monotonic fracture, which is a single force, usually in an abnormal direction, an accident. And fatigue failure, which is a thing we can do something about, multiple small forces, and their impact is determined by their magnitude, frequency, and duration of application. The more times you bend a safety pin, the sooner it'll break. And the application and their direction of delivery. If you change the direction of delivery, you'll weaken the material, whatever it is. So the monotonic fracture, single event, high energy, unpredictable. Jump race falls there. You cannot predict the forces that are going to happen. You cannot predict how the horse will fall. That is going to happen there. We can do nothing about mitigation. But fatigue fractures, the majority of fractures in flat racing, and between obstacles in jump racing, here they're in consistent locations. They follow relatively predictable courses, and therefore the distracting forces, the forces that pull the pieces of bone apart, are predictable. So an individual fracture type can be immobilized and supported in a mechanically logical and, more importantly, a pre-planned manner. Now, there's a little bit of a fly in the ointment. There is some evidence, most of it anecdotal, that fatigue failure at one site will produce abnormal loads in the rest of the bone, and then you can get a monotonic failure. And that can result in some complex and highly unstable fractures. Mercifully, those are relatively uncommon. Epidemiology helps us target on the race course. If we think of the flat racing, we know 94% of fractures in flat racing are in the limbs, not the axial skeleton, the spine. And of those, roughly 2/3 are the lower limb, hock, knee, down, and 1/3 are above that. And really importantly, and Peter alluded to this, over 50% are centered on the fetlock joint. So we have one area which should be a primary target. Last year, the Racing Foundation generously funded the racing support equipment to be supplied to British racecourses, coordinated by the RCA. A lot of lobbying by Simon Knapp, who's here today, to help that happen. Some additional funding from the National Trainers Federation and the Association of Racecourse Vets. And this is what this aims to do. So what are they composed of? Essentially, compression boots, 2 sizes, flexion splints, 2 sizes, and 2 sizes of modular extendable aluminium splints. All of those in a custom-made flight case. And the idea is to optimize the care of injured horses on the race course, and therefore to make a positive contribution to welfare. The equipment's the property of the racecourses. They're permanently labelled with a racecourse identification. Trainers are made responsible for return of equipment that leaves the racecourse, and that means inventory can be tracked. And there's follow-up. There's a record of use follow-up coordinated by the RCA. Compression boot is essentially like a ski boot. It's a reinforced fiberglass cast. There it's radiolucent. You can take x-rays through it there. As you can see, those of you who are unfamiliar with it, the foot plate and the front of the splint are one unit. The second, the back is a divided unit there, cut from the same mold, and it's hinged to the foot plate. It's fastened by tension ski boot type clips. You can't over tighten it. You just pull the 2 sides of the boot together. And then you have rigid external support for the lower limb. The important thing is it fixes the fetlock joint for a forelimb in an extended position, 150 degrees, which is enough to extend the fetlock and for the horse to be able to break over, walk over the leg comfortably. It's got non-slip stuff, everything else. Not important. The important thing are the principles. Second are flexion splints there. You see immediately they place the lower limb in a flexed position. These are made of an aluminium alloy. They're foam lined. They have Velcro fastening, seatbelt type straps to hold the limb in place. So these flex the lower limb in a flexed position here. And then the adjustable aluminium splints. These are aluminium alloy. And this is a clever piece of engineering. It's a rectangular tube with an enclosed sliding screw I-beam, which makes it mechanically very, very strong, but very, very light. Very difficult to bend these with any force at all there. Very strong. And these extend at just over 1 centimetre intervals. You can make them any length, and they stack one on another to make a splint of any size. So the idea is that with the kit, almost anything in the free limb, the appendicular skeleton, can be immobilized in a temporary manner, good enough to move the horse safely and humanely, to undertake further investigation, to have discussion with connections there in a logical manner, and not simply to move horses off the course unsupported, which is inhumane, or to euthanize horses, which can be supported in a logical and sensible manner. The items are easy to apply. there, particularly the compression boot and the flexion splint, they can be put on trackside and allows a horse to be moved for then considered evaluation. It's important to talk a little bit about distress accompanying racecourse fractures. Distress for a horse on a racecourse with a fracture there is loss of limb control more than pain. You will see these horses can have a flail leg, an uncontrolled leg, but eat grass there. Their panic, their anxiety is loss of control. They're a flight animal there. Also, pain is both suppressed and delayed by catecholamines, by adrenaline. There are no more highly adrenaline-charged environment for a horse than being on a racecourse. So the relief of pain and anxiety from appropriate support will always exceed chemical analgesia. There's no question of that. You take an uncontrolled limb, you support it, the horse's respiratory rate comes down, they stop sweating there. You can give all the analgesics you want. That doesn't happen. What does acute immobilization try to do? Well, it restricts local motion, movement of the injured piece there. Neutralizes distracting forces, those forces which will make this fracture move. Of equal importance to the horse is it restores limb or segmental, so portion of the limb control. The horse can control the limb, and that will relieve their pain, anxiety there. If you can put on counter pressure and protect soft tissues, great, but probably less important. Historically, temporary immobilization has really been regional. It used to be just the pastern, the cannon, the knee there, but we now know that individual fractures are distracted by different forces, so that actually doesn't hold water. Because the fatigue fractures have predictable causes, we can then apply support which can be logically can logically counter the distracting forces and can be pre-planned. So let's just look at the common racecourse fractures, mostly from the UK. So condylar fractures, which we've already heard about, sagittal fractures of P1, split pasterns, fractures of the proximal and sesamoid bones, less of a problem here, except in all weather there. And then a little bit about the use of the temporary support system for other fractures, and a few words about pelvic fractures at the end. So condylar fractures, commonest long bone fracture worldwide, UK about 27% of all racecourse fractures, roughly 2/3 in the forelimb, there, and 1/3 in the hind limb, mostly on the outside of the limb, a few on the inside there. Various configurations, but a commonality there in their distracting forces. And the distracting forces essentially are, if you flex the fetlock, a condylar fracture will displace. No question about that there. So you must have the fetlock extended there. And you must provide medial lateral support, because if you lose the collateral ligaments, where the fracture is, then you lose medial lateral support. So the goals are easy. If we have an incomplete fracture, we want to stop it becoming complete. A complete non-displaced fracture, we want it to stop displacing. And if it's a displaced fracture, we want to reduce it as much as we possibly can. And this slide, I think, is the thing that for me nails what you should do in these cases. So displacement of the lateral condylar fracture is always in the same direction. The fractured piece of bone here goes up and it rotates so that the top of the bone rotates forward. Every condylar fracture, complete condylar fracture, does the same thing there. And the pictures on the right here are a post-mortem. There's a horse that actually fractured on the heath here. Surgery wasn't an option, it was euthanized. Simply took off the front of the fetlock joint. Here's the fracture. This is the fetlock flexed, opens up the fracture, produces a step in the joint surface. This is the fetlock extended, closes up the fracture there immediately. So all condylar fractures should have the fetlock immobilized in extension. I actually would now think it's negligent to put a horse with a condylar fracture into a flexion splint. I would find that totally unacceptable on humane grounds alone. I obviously have bias. I'm happy. I'm part of the team that developed the fracture support kit, but it's not the only way. I believe it's the best way For a forelimb is to use a compression boot. Simplest to fit, immediate support, and I think on the course is the technique of choice. Can we play the video now, please?
The Newmarket compression boot is the temporary mobilisation of choice for parasagittal fractures of the forelimb proximal phalanx and for fractures of the metacarpal condyles, as demonstrated here in the fully oiled thoroughbred filling. The boot is opened by unfastening the ski boot clips and rotating these anti-clockwise so that the fasteners remain open and away from the sides of the boot. The leg is then lifted and placed into the boot. The boot is closed and the fasteners are then rotated back to engage the clips, first distally and then proximally. When all four clips are engaged, the fasteners can be tightened sequentially, bringing the front and back plates of the boot into contact. At this point, the limb is rigidly supported and the horse is usually able and willing to lift the leg, and then can be moved at will.
Okay, and we can take the video off there, thank you. So easy to apply, very quick, well tolerated. Doesn't work in the hind limb because of the reciprocal apparatus which links flexion of the fetlock, the hock and the stifle. So here, at the moment, until we can work out a way to design something different, the modular extension splits will provide the rigid medial lateral support and fix the fetlock into an extended position, albeit not in such a rigid fashion. And one of the things I think we need to get over as an industry is the fact these are common fractures, but they are not life-ending there. They are uncommonly life-ending from a humanitarian point of view. They are sometimes life-ending for economic reasons, which is a totally different argument. But the recovery rate for these fractures with surgery, in most cases, is very good. Many horses return to racing. This is essentially a pool of all of the published literature on those cases. A similar argument applies for sagittal fractures of P1. The split pastern, much more common in turf racing than they are on other surfaces. They're about 20% of UK flat racing. Distracting forces, mostly medial-lateral there, but again, most stable with the fetlock joint and extension there. So a compression boot, perfectly good and sensible way forward for those. Now, an argument is often raised almost every year of whether it's necessary or contributory to immobilize all acute fractures, even if it's a little tiny short fracture of the pastern identified on the racecourse or on the training gallops. The answer there, in my opinion, is certainly on the racecourse, yes, because failure to do so is very difficult to defend. The two examples shown here, the fracture, sorry, my pointer's not working, on the left there is on day one, and on the right image there after the yellow arrow is later the same week, unsupported fracture. Fracture on the right, same again, 2 days later, that's what the fracture is. You don't know what you're dealing with in the first few hours of a fracture. Again, recovery rate good, and that needs to be got out to the general public. Horses are managed appropriately, can recover and do recover from these injuries. Fractures of the proximal sesamoid bones, mercifully, less common in the UK than they are elsewhere. And these are simply as a question of surface. Most common on dirt, second most common on synthetic surfaces, least common on turf racing. And these are the so-called breakdown injury, resulting in hyperextension of the fetlock when both sesamoids, medial and lateral sesamoid, are fractured there. And they're important because the fractured ends distract. As the fetlock extends, the fractured sides move apart. And when that happens, one of two things happens to the blood vessels in there. Either the fractured pieces of bone lacerate the palmar vessels, and that deprives the distal limb of a blood supply, or they stretch irreversibly from the overextension of the fetlock. And here we can see such a case here. And this is what happens then. This is a different case there. But the blood vessel stretches so that only the outside layer, the adventitia of the blood vessel, is left intact. The intima and the media are just torn. And that blood vessel will thrombose. It has no prospect of doing anything other than thrombosing. And that horse's fate is sealed at that point in time. It cannot survive. Its foot will slough. So it's important as an acute measure to place these horses, the breakdown injuries, into a flex position. That saves their lives for that moment in time then. You can then have a discussion whether the horse is suitable for a fetlock arthrodesis, which is probably the only way of saving its life, or whether it should be euthanized on humane grounds. But the important thing is to support it at that time in order that those discussions can take place. And here we can see what the flexion splint does. This is a uniaxial fracture, fracture one side. Before it, the splint's applied, and afterwards closes up the fracture gap. And below, hyperextended fetlock, flexion splint applied, closes up the fracture gap. So putting it into flexion, immediate. You can make the decision on the race course. Any injury with hyperextension of the lower limb goes into flexion. If it doesn't hyperextend the distal limb, put it into an extended position there. And they can survive. The survival rates are good. Now, if you're going to undertake a fetlock arthrodesis, there's lots of other considerations, finance, horse's future, everything else, but they can survive with appropriate management. Complex limb fractures may need some thinking about there, because axial control is important. And that probably is the thing to be prioritized in horses on the race courses. Prioritize the horse's axial control of the limb. In the more proximal limb, it's the same thing. We can use the modular extension splints then to allow the horse to control the limb. When the horse can control the limb, then its anxiety is reduced and an elective discussion can take place about treatment, management options, the horse's future. And that can apply at any point. And the last bit I'm going to talk about are pelvic fractures in here. And this is a different form of approach, because here this is where triage on the race course is important here. Many of these are stress fractures, I think, and Pete alluded to that. But again, there's some evidence that overload at adjacent sites can produce a monotonic injury too, and a more complex injury there. Most of those that occur on the race course are complete. They're not fissures, they're complete at that time. Diagnosis is easy in the subacute and the chronic phase, days and weeks later. But on day one is very difficult there. And the key to the triage is to localize the fracture with respect to risk there. How risky is this horse and what are we doing? And the risk of the pelvic fractures from a life-threatening point of view is how close is the fracture to the point where there are major blood vessels that may be lacerated and the horse therefore essentially bleeds to death or loses so much blood that it goes into shock. And that's relatively easy from an anatomical perspective. Horses that fracture their ilial wing here, probably the most common, may lacerate the gluteal arteries, get a great big fat quarter there, very tense, very painful. They don't die from that. Occasionally horses fracture an iliolumbar artery, can be a massive bleed, but they don't really die from that. But fractures of the iliac shaft here can lacerate either of the iliac arteries or the iliacofemoral artery, and they will exsanguinate there. So we need to identify those to assess risk. Some of that is simple clinical examination there. Bony symmetry, has the fracture moved? Which piece of bone has moved independent to which? And that will put you into a pretty good risk bracket. Can be hard to do sometimes because the horses are very tense, they're very painful, can't get them to load the limb, so it's difficult sometimes. If you see the signs, that's fine. If you don't see the signs, it doesn't mean it's not there. But the site of the initial hemorrhage is very good there, but it means you have to observe there. So if the initial hemorrhage is in the croup, in the gluteal area, it's likely to be an ilial wing. Painful, maybe career-threatening, but won't end its life. If the initial hemorrhage is inguinal, or in the perineal area, it's likely to be an iliac shaft, and that may well be life-ending there. If the hemorrhage is down tensor fasciae lata in the iliacus, in the front of the horse's leg, a quadriceps type area, it's likely to be a tubercoxar fracture. Big, painful, not likely to end the horse's life. But it gives you the opportunity then to start rationalizing. Ultrasound, fantastic at that time. You're not looking necessarily for broken bones. If they're there, fine, you see a discontinuity. But you're going to look for hemorrhage. Can we see hemorrhage there? Because that will often be the first sign there, whether that's iliac wing, low risk, iliac shaft, high risk. If it is iliac shaft, the truth is none of those are low risk. It may be non-displaced, but it's not low risk. Movement, very difficult. Those are hard decisions, have to be had with connections at that time. Where do you cross diet? How much do you move it? How much risk can be taken? All of this is a welfare focus, and that's where we have to be, I believe, mitigating the damage caused by racecourse fractures. They're going to occur, but we need to make sure that we are seen as a profession to counter those in the best way that we possibly can. There are public concerns. Most of them are ingrained and polar there, and those beliefs are unlikely to be changeable. The welfare lobbyists there and the extreme organizations are very, very unlikely to change their mind. Most of the people sitting here in the room are very unlikely to change their minds about their perception of racing and their desire to see it continue. The battleground for the preservation of social license will be determined by the open-minded majority who lie in between. Most people have no knowledge, no understanding, and care very little about racing there. It's the man on the Clapham omnibus. They need to be convinced. Equally, we need to get over to the public the concept that injury in racehorses is not life-ending there. This image of fracture and death, we have to lose it, and it has to be a concerted effort to lose that as an industry. I hope I've convinced you that acute fracture support is good for horses and good for racing. Thank you.
Thank you very much, Ian. That was very insightful.